So, good day everyone. Today we will be discussing the influenza. So, let me start on what is influenza. Influenza, or also known as flu, is a contagious viral infection that commonly attacks the respiratory system, and more specifically the nose, throat, and lungs. I underlined or I highlighted the contagious. Why? Because we all know that viruses, kasi hindi mo siya nakikita, di ba? Hindi naman siya nakikita ng ating naked eye unless gumamit ka ng electron microscope. So, contagious siya kasi nga hindi mo siya nakikita. So, hindi mo alam kung na-inhale mo ba siya or nasa katawan mo na siya. And commonly attacks your respiratory system. Why? Hindi ko na siya nalagay dito, pero if you will remember, the respiratory system, binubuo siya ng mga organs and tissues na tumutulong sa'yo upang makahinga ka or that helps you breathe. And isa na doon yung nose. If may kita yung respiratory system kasi, nose, meron tayong pharynx, larynx, which is dito sa bandang throat, then hanggang sa mapunta sa lungs. So, why it commonly attacks your respiratory system? Kasi 'di ba, mostly kapag gumahawak tayo sa mga bagay-bagay, hinahawak natin yung mukha natin. And isa sa madalas na hinahawakan natin sa mukha is yung ilong. Then, since viruses it can be inhaled through air. So, pwede din siya sa droplets ng laway and so on. So, yun, pwedeng ma-inhale siya ng nose. And even this COVID-19 virus, ina-attack talaga niya, di ba? If you're aware, na ina-attack niya ang respiratory system ng patient. And kasi nga, di ba, ang causative agent ito is SARS-CoV-2, which is the Severe Acute Respiratory Syndrome Coronavirus. But iba tong family to. Parang share ko lang, gano'n. Pero iba yung family nitong influenza virus, iba itong coronavirus. Then, influenza virus is caused by different types of influenza viruses, such as influenza A, B, C, and D, and this will be further discussed later. So, in US, influenza is one of the diseases that has higher mortality and higher hospitalization rates, and it mostly happens during winter season. So, why winter? So, kasi for example, di ba, just like bacteria, they have a specific temperature para mag-survive sila dun sa isang place na yun or environment na yun. Just like yung mga viruses. Sa mga viruses na to, mas nabubuhay sila or nagsusurvive sila on cold temperatures. And mostly, sa mga indoors, sa mga loob ng bahay. Why? Kasi 'di ba pag sa loob ng bahay, mas less ang humid ng air kaysa sa labas kasi open area. And kaya mataas ang mortality rate and higher hospitalization rates. 'Di ba pag example nasa loob kayo ng bahay, 'di ba ang virus gusto niya sa loob ng isang bahay. So kapag isa sa inyo sa family niyo is nagkaroon, so madaling magkakaroon ng or madaling may spread yung virus. So kaya kaya mataas ang mortality and higher hospitalization rates during the winter season. So yun. And dati kasi 'di ba, yung mula pang COVID-19 pandemic, hindi natin masyadong nabibigyan ng atensyon itong flu. So according to CDC report, sa USA, between 9 million to 45 million ang nagkakaroon ng sakit na cause ng influenza, and between 140,000 to 810,000 ang na-hospital or na-admit sa hospital because of influenza, and sadly, between 12,000 to 61 deaths annually ang namamatay because of influenza virus since 2010. And good to know lang, let me share. I know if you, alam ko, parang familiar kayo dito, Spanish flu, na nangyari siya during 1918 to 1920, which approximately killed 20 million people. So, 2 taon yung tinagal niya. And isa na dun sa factor na yun, kasi di ba during that time, hindi naman ganun ka-advance ang technology natin. So, hindi agad sila, hindi mabilis yung paghahanap nila ng cure or vaccine to protect them from the virus. So dahil nga walang hindi pa ganoon ka-advance ang technology nila noon, so mostly ang ginawa nila is ng mga non-pharmacological interventions, which is yung makontrol nila yung pagdami ng nahahawa, and mostly isolation, quarantine, hygiene, limitation of gatherings, and the likes. Just like now. So, ang causative agent nun is H1N1, which belongs to influenza A virus. So, yun. Good to know lang. So, ano nga ba ang normal physiology ng body if mag-a-attack yung virus natin? So, di ba, kapag ang body natin ay may na-detect na foreign substances or mga pathogens, I highlighted the pathogens kasi meron tayong mga iba't ibang klase ng microorganism na hindi naman nagkakos ng harm. Pero itong pathogens, it causes harms or disease sa ating body. So, once na-detect ng katawan natin, ito si immune system na activate. So, ang katawan natin, i-induce itong immune system natin, mag-release siya ng mga immune cells para labanan yung mga foreign substances na yon. And one examples of immune cells is the lymphocytes, which is isa siya sa mga WBC, white blood cells. Sila yung mga main cell types na kung saan sila yung naging active sa stage na to. Sila yung pinapatay nila tong mga, or nilalabanan nila tong mga foreign substances na nag-a-attack sa body natin. And pwede din sila mag-produce ng antibodies para makatulong sa pagkawala ng mga harmful substances na yun sa ating katawan. Pero syempre, kapag hindi tayo healthy or hindi maganda ang lifestyle natin, or maaring yung maraming factors like pag matatanda na tayo or mga bata or meron tayong mga sakit na immunodeficiency diseases like STDs, cancer, sila yung mga may hinang immune system. So, anong mangyayari? So, and isa pa yung mga micronutrient or yung mga malnourished patient. Kasi according to my readings, according sa isang scholar, Dr. Melvin Luke, sinabi niya na ang immune system daw at gut natin ay may relationship. Ang gut daw ay contains 70% of immune cells, kaya di ba nga, yung mga malnourished, sila yung mga prone sa sakit kasi hindi sila nakakakuha ng mga sapat na nutrients in order na mag-function ng maigi yung immune system natin. And marami pang factors na pwedeng maka-affect para humina yung immune system natin. So, yun. The normal physiology, kapag nakadetect yung katawan natin ng foreign substances or mga harmful substances, magre-release yung katawan natin ng mga immune responses. So, to continue, and marami pa ding factors na pwedeng maka-affect sa immune system natin. And based sa readings ko din, pwedeng mental health, pwedeng genetics, and others. So, let's proceed to classifications of influenza. So, we have 4 types of influenza viruses. So, first is influenza A, which can be found in many different animals such as bats, ducks, chickens, pigs, horses, cats, etc. So I know you're familiar with these diseases like avian flu from bird, swine flu from pigs. Ito yung mostly na ng mga diseases na nagkaroon sa Philippines. Pero ito mga bat flu, cat flu, hindi siya ganun ka-common sa ating country. So influenza A and B are the main cause of flu epidemics. So because kasi daw ang influenza A and B, mabilis daw itong mag-mutate or magbago according to its genetic properties. So kaya sila yung sila yung commonly caused ng mga flu epidemics. I know you're familiar with epidemics, 'di ba? Epidemics yung certain disease in a community or in a certain area, unlike pandemic, 'di ba, worldwide. And then influenza B, which it circulates widely only among humans, can be spread from human to human. So, unlike sa influenza A, although itong influenza B kasi, di ba isa din siya sa cause ng flu epidemics, pero itong influenza B is, yung pag-mutate yung genetic properties nito is mas mabagal siyang mag-mutate or magbago compared to influenza A. Pero isa din siya sa cause ng flu epidemics. So, ayun, ang commonly na mga common disease is yung human flu or yung, yun nga, seasonal flu, yung common na nakukuha natin. So, ayun lang, kapag hindi siya agad na treat, ito yung mga pwedeng mangyari. Pwede ka magkaroon ng pneumonia, bronchitis, sepsis, kidney failures, and others. So, itong influenza B, it do, uh, okay. Let me proceed to influenza C. So, itong influenza C causes mildness and are not considered to be the source of human flu epidemics. So, I think that is typo. Itong do not cause epidemic sa B. Supposedly, dapat ito sa C. Sorry for the typo. So, it do not cause epidemic. So, ito din, influenza C is very rare or kung magkaroon man tayo ng diseases, ito yung mga mild lang na human flu. So, yun. Very rare cases lang siya. And it do not cause epidemics. So, lastly, influenza D, which is mainly present in cattle, sheep, pigs, and goats. And according to researchers, it is not yet proven that it can infect or cause illness to people. So, itong influenza D, mostly sa mga nabasa ko sa ibang bansa lang to. Hindi siya common dito sa atin sa Philippines. So, ang isang diseases na pwedeng makuha is bovine respiratory diseases complex or pneumonia in cattle. So, that's it.
So, good day everyone. So, dito sa slide, makikita nyo yung structure ng influenza virus. Dito, sa kanyang core is yung nucleoprotein, specifically RNA. Yan yung genetic material na nagko-contain ng information needed to make more copies of the same virus. Dito naman is yung capsid. Capsid or the protein shell of the virus, ang ginagawa naman nito is that it provides a hard protective enclosure for the genetic material as the virus travels between people or animals that it infects. Next is dito, yung lipid envelope or the outer envelope. It allows the virus to infect cells by merging with the cell's outer membrane. Then, projecting from the outer envelope is the spike proteins. Yung spike proteins na tinutukoy po natin is yung neuraminidase or sialidase proteins or the N spikes and the hemagglutinin or the H spike. Yung hemagglutinin yan, yung red. Yung neuraminidase naman is itong blue. So, yung work ni neuraminidase or sialidase is mag-cleave out or mag-break out from the infected cells to infect more cells, mag-cleave out. Basta ganun. Explain ko mamaya kung ano talaga yung work niya. Yung hemagglutinin naman serve as a key to unlock the host cell. Mamaya din, explain ko sa next slide. Okay. For the pathophysiology. So, when the virus enters the respiratory tract, it attaches itself to the respiratory epithelial cells by using its hemagglutinin protein spike to bind with the receptors in the cell surface, causing cellular infection. The virus then replicates inside the cell membrane. Then, after replication, the newly formed virus moves out of the cell membrane and by using its neuraminidase protein to cleave the band of the virus out of the cell's receptor, permitting the spread of infection, thus triggering an immune response associated with the release of cytokines, leading to symptoms of sore throat, runny nose, and cough. So, ganito kasi nangyayari. Pagkapasok ng virus sa atin, sa katawan natin, specifically sa respiratory tract, gagamitin niya yung kanyang H spike or yung hemagglutinin spike niya para mag-attach doon sa cell receptor ng ating mga healthy cell. So, once na mag-bind na si H spike doon sa receptor, makakapasok na yung virus na yon sa ating cell. Once na makakapasok na siya doon, magta-travel siya papunta sa nucleus. Pagpunta niya doon, before siya dadating sa mismong nucleus, yung viral envelope, yung viral envelope, mag-combine siya with the cell membrane. Once na mag-combine siya, it allows na yung genetic material lumabas sa kanya. Pupunta yung mga genetic material, yung mga nucleoproteins na to, specifically RNA nucleoproteins na to, lalabas sila, pupunta sila sa nucleus. Pagdating nila sa nucleus, gagamitin nila lahat ng energy and macromolecule components ng nucleus para gumawa ng mas madami pang copy ng kanilang sarili or maggagawa sila ng copy of the same virus. Ayun, pag nakagawa na sila ng copy ng same virus na yon, pupunta ulit, lalabas na sila sa cell membrane kasi meron na silang gawa, lalabas na sila. Naalala nyo yung receptor na kung saan nag-bind yung original na virus na pumasok? Ngayon, yung bagong gawa na virus na na nakalabas ng cell membrane, wala siyang kawala doon. Mag-a-attach ulit siya doon sa receptor. Yung H-spike ng bagong gawa na virus, mag-a-attach ulit doon sa receptor. Ngayon, yung function ni N-spike or neuraminidase protein spike is i-cleave niya, i-break niya yung connection na nangyari sa H-spike tsaka sa cell receptor. Ngayon, pag na-break niya na yon, free na yung bagong virus na mag-infect pa ng other healthy cells. Ngayon, yung na-infect, yung cell na nag-reproduce, nag-replicate ng mga virus na to is nawala sa kanyang natural function. Ngayon, since nawala siya sa kanyang natural function, ginagawa niya yung hindi naman niya usually ginagawa, nanibago siya and all. So, ang nangyari, nagkaroon ng structural damage. Yung structural damage na yon, it leads the cell to die or cell apoptosis. Next. So, for the pathogenesis, the underlying pathogenesis mechanism of influenza virus is that these viruses can infect various types of cells in the human respiratory tract and replicate inside, which is nabanggit ko kanina. Viral replication damages its infected cells to cause their apoptosis. Nabanggit ko na rin kanina. So, once influenza virus enters the human respiratory system, it adheres and penetrates into the epithelial cells for it to replicate there for 4 to 6 hours. Imagine nyo, sa 4 to 6 hours, sobrang dami na nang na-replicate na virus na yon. So, ano nga ba yung route or transmission kung paano natin nakukuha yung influenza virus? Meron tayong tatlo. Una, person to person via inhalation of respiratory droplets. Yan, for example, nag-uusap kayo ng kaibigan mo, sobrang close nyo, bulungan kayo ganyan, yung distance nyo wala pang 5 meters, bigla siyang bumahing. Pak! Pagbahing niya, yung mga droplets napunta sa bibig mo, sa ilong mo, pak! Yon, pumasok yung virus sa katawan mo, nag-replicate and all. Yon, number 1 yan, person to person. Yan, nakakuha ka na ng influenza virus. Second is that if a person touches an object contaminated with respiratory secretions such as mucus or phlegm, dito, pwede mo makuha from inanimate objects papunta sa'yo. For example, sa school, nagna-notes kayo, ganyan-ganyan. Tapos, biglang bumahing si kaklase. Ginamit yung pangtakip is yung kamay niya lang. Ginamit niya yung, pagkatapos nun, hindi siya nag-alcohol. Nagsulat ulit siya, gamit yung ballpen. Siyempre, gamit yung ballpen kasi college na siya. And then, ang nangyari, ikaw, nakatabi niya, nawala na ink yung ballpen mo. For example, nanghiram ka ng ballpen. So, yung hiniram mong ballpen, yung exact ballpen na ginamit niya, na gamit yung kamay niya na pinangtakip niya sa pagbahing niya. Sa pagkuha niya yon, ginamit mo, sinulat mo. Sabi mo, medyo nag-ano ka, hinawakan mo yung ilong mo, hinawakan mo yung bibig mo, unconsciously. Ayun, sa ganung process, pwede ding makuha na yung influenza virus. Next is, transmission can still occur as long as the infected person is shedding virus from the respiratory tract. Usually kasi, yung viral shedding, nangyayari siya 0 to 24 hours before nagkaroon ka ng onset of symptoms. Pero, pwede din siyang mangyayari, nagkaroon na ng symptoms yung tao na infected ng influenza virus, 5 to 10 days, nagkakaroon pa din ng viral shedding. Yung viral shedding, nagkakaroon pa din ng replication, ganon. And then, depende din sa case. Pag immunocompromised yung patient, pwedeng tumagal from weeks to months. So, ayan. So, ito yon. Ito yung pinaka-shortcut dun sa mga sinabi ko. The virus, i-enter siya sa cell. Once na nandun na siya sa cell, iti-take over niya yung internal machinery ng cell natin para makapag-produce ng mga duplicate ng virus. Pag umalis na siya, since the cell cannot return to its normal natural function, namamatay yung cell, ayun, pagka na-release na yon, nagkaroon na ng madaming infection, yun, nakakaranas na tayo ng mga unpleasant symptoms. Mas madumami yung infection, nakakaranas na tayo ng mga unpleasant symptoms. So ito, next, the populations most susceptible to influenza virus are the children, pregnant women, elderly, people with underlying chronic medical conditions, and immunocompromised individuals. So, why children? Maliban sa yung mga bata mahilig sa hiraman ng gamit, minsan hindi na naghugas ng kamay, ah, minsan din then hindi pa ganun ka-strong din yung immune system ng mga bata. And then next, for the pregnant women, bakit yung mga buntis delikado din sila? Kasi the changes in the immune system, heart and lungs during pregnancy make pregnant women very prone to diseases. Isa na dito, si flu. And then next, elderly people, same nga, yung mga matatanda, hindi na rin ganun ka-strong yung kanilang immune system, pati na yung mga may underlying chronic medical conditions, and pati na yung mga immunocompromised individuals. Medyo weak na talaga yung, hindi talaga medyo, weak na talaga yung kanilang immune system. And as we all know, yung immune system, necessary siya para i-fight yung mga virus, bacteria na pumapasok sa ating katawan. So, ito note, the incubation period for the influenza or flu disease is 1 to 7 days. Adults are considered infectious on the first day of illness, and children have higher chances to be infectious for longer periods or for approximately 10 days. So, ano nga ba yung incubation period? So, yung incubation period, ito yung panahon sa pagitan ng pagka-expose mo sa infection at sa unang paglabas ng symptoms. Ang unique kasi dito sa influenza is that pwede siyang makahawa. Wala ka pang nararamdamang sipon or flu symptoms, ganon. Wala ka pang nararamdaman, pwede ka na makahawa sa ibang tao within 0 to 24 hours. And then, pwede mo ding mahawa yung ibang tao na meron ka ng symptoms. So, in short, yung influenza virus, pwede mong matransmit nang wala ka pang symptoms or wala pang symptoms na lumalabas sa'yo, mga ilang, kunyari, 1 day before lumabas yung symptoms, yung mga na-interact mong tao nun or nakakausap mong tao, kamustahin mo din kasi possible na makuha din, na-transmit mo na yung virus nun. And then, yung mga tao din nakausap mo nung meron ka ng nararamdamang hindi maganda sa katawan mo, kamustahin mo din kasi posible din na napasa mo na. Di mo lang, binawaliwala mo lang kasi yung symptoms. Ganon. So, for the clinical manifestation,
For the clinical manifestations, um, alam naman natin na most of us have experienced flu or flu-like symptoms. So, having influenza, it is approximately within a week, 3 to 7 days bago ma-resolve ang influenza. Pero, uh, cough and malaise, pwede siyang magstay for up to 2 weeks. So, yung common or general signs and symptoms na meron ng isang patient na may influenza virus is fever as part of the body's immune response against the virus, as well as to um, increase the body's temperature in fighting the virus. Yan, by increasing temperature of the body. Next is myalgia, headache, and malaise. So, when our body produces immune responses and antibodies, uh, our parts, these parts of the body, muscles, our head, and our physique is very well affected. And next is non-productive cough. Ang difference ng sa non-productive cough ay ang non-productive cough ay mostly present sa mga viral diseases, especially sa mga upper respiratory tract diseases. And yung mga productive cough natin mostly ay cause sila ng bacterial infection. So, pwede ka din magkaroon ng sore throat. Um, kasi nga since dahil nga sa non-productive cough, um, mas nai-irritate yung throat natin. Kaya yan, mas nagiging inflamed sila due to non-productive coughing or dry cough. Another one is rhinitis. Kasi another part of the body where the virus can be deposited. Of course, if there is the virus there present, pwede magkaroon din ng inflammation, hindi lang sa lungs natin. Next, commonly reported in children, yung nausea, vomiting, and otitis. Ayan. Next slide, please. So another one, if mas lumala yung influenza natin, pwede silang mag-proceed sa primary viral pneumonia or secondary bacterial pneumonia. So primary viral pneumonia, it occurs predominantly in pregnant women and in those with underlying cardiovascular disease. While yung secondary bacterial pneumonia, usually seen in individuals with underlying pulmonary disorders and present during the early stages of the effervescence of from the influenza infection. So, yung difference sa kanila is, pag primary viral pneumonia, it is caused by virus. Pag secondary bacterial pneumonia, it is caused by bacteria. So, bakit yung secondary pneumonia bacteria? Tapos, yung sa una virus yung nagkakos. So, primary viral pneumonia, most commonly na naapektuhan ng primary viral pneumonia is yung mga person na medyo okay yung um, immunity ng katawan nila. So, yung since pneumonia, yung virus yung magkakos ng inflammation sa mga air sacs natin. So, sa secondary bacterial pneumonia naman, since sabi ko nga kanina, bacteria yung nagkakos ng pneumonia, inflammation sa air sacs sa lungs natin. And since secondary siya, first is magkakaroon ka muna ng virus na influenza, and then yung influenza pwede siyang magkaroon yung patient ng compromised na immune system, hence mas capable yung bacteria to invade the lungs. So yun nga, tulad din ng sinabi dito, usually seen in individuals with underlying pulmonary disorders. So yan, at risk yung mga gantong tao. The next slide, please. Yan. So, punta naman tayo sa screening and clinical diagnostic. So, first step is, syempre, we collect the specimen or um, our first part of the diagnosis. So, syempre, influenza virus is an upper respiratory tract disease. We have to get our specimen from the upper respiratory tract. So, ang pinaka the best na or pinaka the best na specimen na pwedeng pagkuha na natin is sa nasopharyngeal. So, bakit nasopharyngeal? Meron namang nasal and throat. Anong pinagkaiba nila? Sa nasopharyngeal kasi, mas madami yung napoproduce niya na sputum, or yun nga, mas madami kang makokollect na sorry. So, madami kang makokollect na specimen kaysa sa nasal and throat swabs specimen. So, yun. If wala yung nasopharyngeal specimen, of course, we have to deal using nasal and throat swab specimen. Etong nasopharyngeal specimen and nasal and throat swab specimen is ginagamit siya mainly for sa mga outpatients natin. Pero once nasa hospital, admitted ka sa hospital and you are under ventilation, respiratory ventilation, you are required to they're required to do endotracheal aspiration. So, yun, kuha sila ng bronchoalveolar lavage fluid specimen. Next slide, please. So, yun. So, ito yung mga laboratory na kailangan, CBC, para malaman yung overall well-being, yung ano natin, kung affected ba yung red blood cells, nag-increase ba yung lymphocytes natin, yung white blood cells natin, or para as well ma-monitor din if mayroong co-infections. Next is viral culture, na-explain ko din mamaya, which is culturing of virus to identify what specific virus has entered your body. Next is culture protection sites of infection. So, tulad nung sa pneumonia, pwedeng magkaroon ng other infections aside from influenza, pwedeng other virus, and pwede ding bacteria. And chest radiograph. So, chest radiograph ay ginagamit kapag ang isang person ay suspected to have pneumonia. So, yun. Sa chest siya tinitignan. Next slide, please. Then, doon naman tayo sa mas scientific part ng pag-assay kung para malaman kung anong type ng type ng influenza virus or kung influenza ba talaga siya as a confirmatory and quantifying um, method. So dito medyo i-discuss ko siya pero yung mga gagamitin kong terms ay para magkaroon lang kayo ng idea kung ano yung mga ito. So first is influenza molecular assay, rapid influenza molecular assay. So mamaya explain ko kung bakit sila tinawag na rapid. So dito, ayan, detect influenza viral RNA in upper respiratory tract specimen utilizing different nucleic acid amplification technology. So, what they do here is that, yun nga, they amplify nucleic acid. So, ibig sabihin, they increase the number of as much as possible of nucleic acids or RNA which they can use to classify and para mas sure nila, ma-confirm nila na meron ka talagang influenza virus. So, kung makikita natin dito sa picture, yan. Yan, ano yan? Isang strand yan ng RNA. So, from the virus. So, kung mapapansin natin, ayan, merong mga kumakabit diyan. So, dun sa first part natin, alam naman natin yung DNA synthesis. And first part ng sa DNA synthesis, meron tayong tinatawag na primer o yung parang panimula. Yung siya yung nag-i-start ng sequencing. So, ang ginagawa nila dito, they at least need 4 to 6 primers in order to magtuloy-tuloy yung process ng chain para mas makakuha silang mas madaming data. So dito, ang goal dito is yung third first and third sa magkabilaan ay dapat magkaroon ng same sequence. Ang nangyayari pag nagkaroon silang ng same sequence, so yun makikita nyo na lang. Same color, yun na lang yung parang indication na same sila ng sequence. Ang nangyayari, pag nagkaroon sila ng same sequence is nagkaroon ng automatic looping. Ayan, so nagkaroon ng automatic looping from both sides. Ayan, yan, nakita nyo. Both, dun sa pang-apat na picture, dito sa baba, ay parehas silang orange, parehas na green. Once they have done this looping, this is much more better kasi nga, pag nagawa nila tong looping, any part of this, pwede yung primer na gamit dito is, pwede silang mag-attach anywhere of that. So, magbe-build up sila na magbe-build up hanggang sa mas madaming specimen yung magawa. So, parang multiplied yung habang nagdo-duplicate sila gamit yung primer na umpisa, nagmo-multiply, mas lumalaki yung chain. Ayan. So yun, it can produce results in approximately 15 to 30 minutes. Next slide, please. Next naman is, next slide ulit. Mamaya na yan. Ayan, another rapid test is rapid influenza diagnostic test. So ito, uses enzyme immunoassays to produce result within 10 to 15 minutes. Yan. So, dito, when we say enzyme immunoassays, ang goal dito is yung mag-attach si antibody sa antigen. So, merong specific na antigen. For example, antigen ng influenza A or B. Then, if positive, the antibody enzyme will attach to the antigen. So, if seen positive, merong magkakaroon ng interaction. So, yan, create siya ng color change, which means positive siya sa influenza. Most more likely ginagamit si rapid influenza diagnostic test in identifying A and B or differentiating if yung person has influenza virus A or B. Yan. So, yan, another one is that it is preferred in outpatient setting. Pakibalik ng isang slide, please. Yan. So, ito naman, reverse transcription polymerase reaction chain. So, it is the most sensitive, specific, and versatile diagnostic test for influenza. So, ito, pinag-aiba niya sa rapid is hindi siya rapid. Okay. Hindi siya rapid. So, bukod sa dito sa nakikita natin sa sa diagram sa picture is meron siyang preparation, and yung preparation na yon, isa yon sa factor kung bakit mas matagal kung makuha si RT-PCR. So itong approximately 45 minutes na to, pwede siyang magtagal into several hours talaga. So yan, so sa umpisa, kukuha muna sila, i-retrieve nila or i-purify nila yung RNA ng virus na nakuha nila sa specimen, sa upper respiratory tract specimen. So, ayan, gamit ulit yung primer. Ayan. Mag-create sila ng parang isang DNA chain. And yung DNA chain na yon, i-reverse transcribe yon para mag-create ng another chains dito ng RNA, tas magiging DNA, then hanggang sa dumami ng dumami yung chains na yan. So, ganun siya, dumadami and na-identify kung ano yung type ng influenza na yon. Ngayon, ang differences sa rapid based sa process niya mismo dito sa process na to is pag sa rapid, meron kasing temperature na dapat na kino-consider dito. Sa rapid kasi, isang temperature lang, especially dun sa rapid molecular assay, 65 degrees Celsius lang continuously yung ginagamit na temperature. Meanwhile, dito sa reverse transcription polymerase reaction chain, we use different temperature kasi uh, at low temperature, mas nagbabind si DNA ay si RNA, creating a DNA chain like. Pero pag tinaasan ulit si temperature, maghihiwalay ulit sila, then after nun ibababa ulit yung temperature para mag-create siya ng panibagong sa coexisting. So yun, ganun siya nagdo-duplicate, kaya mas matagal siya kaysa dun sa mga rapid testing natin. Next slide please. Yeah. Another one is sa influenza molecular assay. Pala, sorry. Another one is the immunofluorescence assay. So, ayan, antigen detection assay that requires use of fluorescent microscope can produce results in approximately 2 to 4 hours with moderate sensitivity and specificity. So dito, same lang siya, para siyang sa rapid influenza diagnostic test. However, pinagkaiba dito is they use secondary antibody fluorophore label, which attaches to the primary antibody, na kapag tinignan mo sa microscope, kapag nag-attach siya dun sa antibody na yon, ibig sabihin may presence. Yan. So makikita sa microscope yung kulay na yan, iba-iba yung kulay, pero more on fluorescent. Ibig sabihin there is a presence of a virus. Next slide, please. So yung other influenza molecular assays natin is viral culture, considered as the gold standard for diagnosing influenza. However, bakit hindi masyadong ginagamit si viral culture? Kasi si virus kasi, para more likely na hindi na siya attainable sa specimen within 3 to 4 days. So after ng 3 to 4 days, hindi na siya hindi na applicable yung mga specimen na natin dahil hindi na natin makikita kung talagang merong virus doon sa makukuha nating specimen. Kasi si viral culture ay pwede siyang mag-last up to 3 to 10 days. Yun. Meron siyang high sensitivity. That's why it is considered as a gold standard. However, kung iko-consider naman natin yung, um, pagkuha nung specimen and confirming and knowing what virus is, parang late na. Late na natin malalaman. Minsan gumaling na siya, late na natin nalaman, gano'n. Next is serologic testing. Routine testing requires paired acute and convalescent cells. Dito naman, serologic testing, medyo hindi siya ginagamit na ngayon kasi as far as I have discussed is dun sa mga 4 na nauna natin is mas specific sila. They get purified RNA, they check for nucleic acids, ayun, mga ganon, and antibodies, antigen, they use that. Pero sa serologic testing, we go back to blood. They use blood to identify what antibody is currently in our body. Yan, ganun. So, more on, same lang din siya sa viral culture, pero mas matagal yung results niya. Hindi ganun ka-timely talaga. Like, tulad nga sabi ko, tulad ng viral culture. So, generally, not recommended siya except for research and public health investigation wherein urgent or timely results are not that required.
Good day everyone. I'm here to discuss the treatment and medication for influenza. So the best treatment are preventive measures. This includes vaccination, that I will discuss later, control measures, such as hand hygiene, basic respiratory etiquette, and contact avoidance. These control measures are the things that we temporarily practice today during this pandemic. Especially the basic respiratory etiquette such as covering yourself when coughing, sneezing, and throwing the tissues you used away. Include ko na rin dito yung mask wearing, lalo na kung may symptoms ka, dahil ang influenza can be transmissible via droplets. Next. So, vaccination, it helps prevent transmission, hospitalization, and death among high-risk people. Its mechanism of action that it imparts immunity against the influenza virus by stimulating production of antibodies that are specific to the disease. Kaya siya nakakapag-prevent ng transmission and hospitalization dahil once you have immunity, the antibodies will fight off the virus that enters your body. According to the normal physiology of the immune system that was mentioned earlier, these antibodies will attach themselves on the virus and neutralize it. Therefore, the virus will no longer elicit some of its symptoms. And alam naman natin, yung symptoms talaga yung nakakamatay when it comes to infectious diseases. So the first vaccine is the inactivated influenza vaccine with the brand name Fluzone quadrivalent. It is used for 6 months and older regardless of their immune status, can be administered to pregnant women. It is administered intramuscularly, and one of its frequent adverse drug reactions are the pain at injection site, fever and malaise, and usually seen for people who have not been exposed to viral antigens. Kaya ganito, because there's no antibodies yet that has been developed. Kasi once na binigyan ka ng vaccine, it will trigger a slight immune response that in a form of fever and malaise. Because naka-encounter siya ng bagong foreign body. Yung foreign body na yun, yung inactivated flu virus. Ayun. Nevertheless, yung body mo pa rin will build up immunity against it. Ay naman yung purpose ng vaccines para magkaroon ng memory cells yung mga antibodies mo. The next time na mag-encounter ulit yan ng virus sa labas, magiging immune ka. You will not develop symptoms or any signs of the influenza. Next. So, kung kanina is inactivated, ito naman, live naman to. Live attenuated influenza vaccine with the brand name FluMist quadrivalent. It is approved for people's ages 2 to 49 years old, and it cannot be used for pregnant women and immunocompromised patients. Hindi siya pwede gamitin sa mga pregnant women dahil yung mismong virus, di ba, live nga. So, ibig sabihin buhay ito. Pwede siya pumasok sa placenta ng mga buntis and may cause an infection to the fetus. Sa immunocompromised naman, immunocompromised sila. Ibig sabihin, mahina yung immune system nila. Ayun din, wala silang, onti lang yung antibodies na na-develop nila. Same goes with the lymphocytes. So, once na itong live live influenza vaccine tinurok sa mga immunocompromised patient, it could accumulate in the blood, causing viremia. And also bacteremia na din dahil immunocompromised sila. Ayun din, it applies also sa mga, kaya hindi rin siya ginagamit sa mga bata na 1 pababa dahil di pa ganun ka-develop yung immune system nila. So the most frequent ADR are the runny nose, congestion, sore throat, and headache. Ito rin, in connection din to sa pagiging buhay ng influenza vaccine dahil ang nagkakos nito yung tinatawag na viral shedding. So the dose for both adult and pediatric is 0.2 ml with the dosage form single-use sprayer. So now for the post-exposure treatment. So ano naman mangyayari kapag hindi ka nagpa-vaccinate ng flu vaccine pero nagkaroon ka pa rin ng influenza? So ito yung bibigay sa'yo. This is the first line treatment if the disease was diagnosed within 48 hours. Ito, explain ko mamaya kung bakit within 48 hours dapat para matreat yung influenza. So the first line is Baloxavir. It is orally administered, recommended for 12 years and older. The dose is 40 milligrams for 40 to 80 kilograms body weight and 80 milligrams for more than 80 kilograms body weight. So the mechanism of action is that it's a cap-dependent polymerase acidic endonuclease inhibitor that interferes with the viral RNA transcription and blocks virus replication. So, sinabi na rin sa MOA kung anong type of antiviral siya. Ayun nga, cap-dependent polymerase acidic endonuclease inhibitor. Naalala nyo naman kanina na in-explain sa pathophysio on how a virus replicates. They will use the endonuclease to start the replication inside the cell. Pero since uminom na yung patient ng Baloxavir, it will block the transcription and thereby inactivate the flu virus itself. So hindi na magkakaroon ng replication or pagkalat doon sa respiratory tract. Next. So, for the post-exposure treatment, again, another first-line treatment is the neuraminidase inhibitors. Its mechanism of action is that it inhibits the neuraminidase spike or the NA spike protein, thereby the release of the virus from the infected cells is impaired. Thus, viral replication is decreased. Naalala nyo ulit that the NA spike is crucial for viral spread or replication. Kasi once natapos na sila mag-replicate sa loob ng cell, they will move out. Aalis sila dun sa cell. Para gawin yun, gagamitin nila yung mga NA spikes na yan, mga neuraminidase spikes, para i-detach yung sarili. Thereby, mag-i-infect na naman sila ng panibagong cell doon sa respiratory tract. Ngayon, ang gagawin naman ng mga NA inhibitors na yon, so they will inhibit the neuraminidase spikes. Therefore, the viral cell will not detach from the infected cell, and thereby it will bababa yung pagkalat nila. They will decrease the replication of the virus in the respiratory tract. So, ito yung mga examples ng neuraminidase inhibitor such as oseltamivir, approved for 14 days and older, orally administered. Zanamivir, inhalation, adult dose is 10 milligrams daily for 5 days. It may cause bronchospasm. Connected kasi siya on its administration, which is inhalation, kaya nagkakos siya ng bronchospasm. Next naman is peramivir for uncomplicated influenza in ages 2 years and older. It is given IV for 15 to 30 minutes and 600 milligrams for both adult and pediatric. So what if the disease was diagnosed after 48 hours? Ayun, antivirals can still be administered. However, it is not as effective if it's given after 48 hours. Kaya siya binibigay during the first 48 hours. Ay nga, because this is before the symptoms are not that severe. The virus itself is not that replicating. I mean, yung virus pa lang dito sa first 48, hindi pa siya tapos mag-replicate. Nasa isang cell pa lang siya. Meaning, so onti pa lang sila. Yun, onti pa lang yung virus. So, mas maganda na maagapan agad before mag-spread sa buong respiratory tract yung virus. Ayun. Ay nga, kung after 48 hours naman, tapos binigyan mo pa rin ng antiviral, it will be not much effective. Di ko naman sinasabi na hindi na siya gagana. Ang lang is bumaba yung effectiveness niya. Kaso, dahil kumalat na kasi yung virus, doon sa respiratory tract. So mahihirapan na mismo yung drug para i-inhibit lahat ng mga or mag-bind dun sa mga virus para i-inhibit yun kasi masyado nang marami. So ang gagawin na lang is supportive care with adjunct therapy such as acetaminophen for fever and antihistamines for rhinitis. So fever and rhinitis, these are the major symptoms of influenza na binanggit na rin kanina. So ito, amantadine, they belong to a class of adamantines, regarded as an obsolete treatment due to viral strains that develop resistance against it. Ayun, di naman siya kinonsidered na obsolete treatment ng FDA. Di lang siya kasi nirecommend na ng doctor. Ayun nga, dahil sa marami na kasing resistant na viral strain sa gamot na ito. Kaya nagde-develop kasi ng resistant ang mga most flu viruses against amantadine dahil over time the flu virus changes its active site when it starts to infect. Thereby, it will decrease its susceptibility to that antiviral drug. So, next is, these are the non-pharmacological therapy. So, patients suffering from influenza should get adequate sleep and maintain a low level of activity. Isa rin sa mga symptoms kasi is fatigue. So, mahirapan ka rin gumalaw. Kaya the best na magpahinga ka na lang kapag may influenza ka. They should stay home from work or school in order to rest and prevent the spread of infection. So, ay nga, via droplets kasi ang influenza. So, like nangyayari ngayon sa ngayong pandemic, mas ini-encourage na mag-work from home na lang or ay nga sa school, online class na lang muna para mabagal yung pag-spread ng infection. Appropriate fluid intake should be maintained. You need to be hydrated kapag may influenza ka. And also, ito lang is to manage for symptoms, cough, throat lozenges, warm tea, and soup may help with the symptom control such as cough and sore throat. So for the treatment algorithm, it is composed of two figures, the blue figure and the red figure. In the blue figure, ito yung instructions on what happens if the patient is test positive for influenza. While on the red figure, what will you do if the patient tests negative for influenza? So first, you will make an interpretation. If the patient has a positive result, so most likely it's an influenza viral infection. While the other, if the patient tests negative for influenza, the first interpretation would be is that the test used does not have high sensitivity to detect the influenza virus. Kasi sa case na to, sa pinapakita sa red figure, nagpapakita siya ng symptoms. Pero, yung tinest siya, negative daw siya. So, ayun. So, there must be a problem on the test they use. Dapat ang ginamit nila yung mga specific tests, yung influenza molecular assays. That yung binanggit kanina. Next. So, kung nalaman mo na positive agad yung patient for influenza, the first thing to do is to initiate the antiviral treatment as soon as possible if clinically indicated. So kanina nga, sinabi na nga na dapat yung treatment is within 48 hours dahil ayun pa yung time na yung symptoms hindi pa ganun ka-severe, meaning hindi pa ganun kumakalat yung virus. So madali siyang matitreat agad. So implement infection prevention and control measures. So once na nagpapakita pa rin ng symptoms yung patient, kailangan pa rin i-practice yung control measures such as the hand hygiene, the respiratory etiquette, and the contact avoidance. Again, alam naman natin kung bakit pinapractice yung respiratory etiquette para hindi na rin makahawa ng iba. Ayun, pagtakip habang umuubo, and also yung contact avoidance. Furthermore, consider additional influenza viral testing if confirmation is desired or if subtyping of influenza A virus or distinguishing between influenza A and B viruses is needed or more specific analysis are needed. So, ngayon, kailangan ng additional test para malaman kung influenza A or B siya. Pero, sa kasi, yung baloxavir, kaya siya first line treatment kasi it affects both influenza A and B. So, ayun. The last one is that you should consider additional diagnostic testing for other pathogens or empiric treatment for bacterial co-infection if indicated. So, sinasabi lang naman dito, since, kasi pag nagkaroon ka ng influenza, pwede ka magkaroon ng titawag na ng secondary pneumonia. Kaya nga, binanggit na rin ito kanina, and ang mostly cause ng secondary pneumonia ay ang Streptococcus pneumoniae. Ayun, so ang kailangan dito is that antibiotic therapy once na-diagnose ng ganun. Now for the negative naman, kung ang patient naman is tested negative, ito yung mga actions na gagawin nyo. So use clinical signs and symptoms, medical history, and physical examination, and information on local influenza activity in the community to decide if antiviral treatment is indicated. So dito kasi, mali yung test na ginamit. So ang best na unang kukuha ng information ay yung medical history and also symptoms. Dun sa local influenza activity, so hahanapin din para kung ang patient is nahawa lang or may nakasamuluhan na may influenza din kaya nakaganyan siya. So yun, pwede gamitin na rin yun as information for diagnosis. And also, para makapag-administer agad ng antiviral treatment. So initiate antiviral treatment as soon as possible if influenza is suspected and if the patient is a high risk of influenza complication, has progressive disease, or being admitted to hospital without waiting for the results of additional influenza testing. Ito rin, katulad lang dito na sinabi ko na kailangan mag-initiate agad ng antiviral treatment para ma-decrease yung severe complications. Lalo na kung what if itong patients na to na nag-test for negative sa influenza ay may comorbidities. So, magkakaroon ng chance na maging severe yung influenza sa kanyang katawan. So, consider additional influenza testing if indicated. So, ayun na nga. Sa una pa lang, mali na kasi yung test na ginamit. So, kailangan pa ng further testing para malaman kung anong type ng influenza ang meron yung patient na ito. So for the last one, consider additional diagnostic testing for other pathogens or empiric treatment of bacterial infection if indicated. So katulad lang din ng sinabi ko kanina, ang patient na may influenza, susceptible siya with secondary pneumonia. So antibiotic therapy is recommended. So that is all. Thank you for listening.